Dr. Michael Osterholm is one of the president's former medical advisors who is urging him to make some changes. He's the director for the Center of Infectious Disease Research and Policy at the University of Minnesota. Doctor, thank you very much for being with us today. I guess I'd like to ask you right off the bat, what made you publish this strong group of letters?
Well, first of all, let's characterize them for what they really are. What we are trying to do is look forward to 6 months to a year from now or longer. Right now, we're in a crisis state. Every country in the world is in a crisis state. Every leader is trying to deal with this issue, even looking at what's happening in China. And what we're trying to do is say, well, you know, it's important to stay focused on now, but we're going to have to live with this virus going forward. And so what are the steps we need to take that need to be the transition to getting to living with the virus? And so this was not a criticism of what we're doing right now. This is not at all calling for a sudden change in the program. It's talking about how after 2 years are we going to have to grow what we do to live with COVID.
But you do point out that you feel like in this current wave of Omicron that you're borderlining too late for vaccinations that happen now to work for this. You also say that N95s are the only masks that really make a difference and that they're not widely available and that testing is inadequate.
Well, let's take each one of those. I think they're very important points. First of all, if you look at the issue of testing, every country in the world right now is in the soup. The United Kingdom and Israel were touted as having the best testing programs in the world with the most availability, and they're having the same challenges that we're having right now. This is a surge. You suddenly had a level 6 hurricane hit us, and testing needs are incredible. We just can't meet it. In terms of looking at where we go with vaccines for the future, you're right. Not everyone's going to get vaccinated. But remember, if I were on this show, and of course it didn't exist in 1983, but if I were on this show in '83, we would have all talked about the death sentence that HIV posed. Being positive for the virus meant you were not going to live long. But then guess what? We didn't have vaccines, but we had developed drugs, therapeutics that have now made large parts of HIV literally a chronic disease. Well, that's going to be part of the picture going forward. It's going to be a combination of vaccines and drugs that, when given to people in the earliest stages of the illness, will actually help prevent them from getting seriously ill. So what we're really talking about is all of those kinds of changes that can help get us to a point of the future.
Understood. You know, you talk about other countries that are in a similar boat. And I think there's always a feeling in this country that we should be the people who know how to handle it the best, because we do spend an extraordinary amount of money. I'm going to put up on the screen funding for NIH, for the Institute of Allergy and Infectious Diseases, and the Department of Health and Human Services combined about $51 billion in funding just for 2021, right? And you point out in the articles that were put out by your group that you sort of are frustrated that we don't have a modern data infrastructure. And I think a lot of us are frustrated that we don't. Why aren't we doing better surveillance? We've been dealing with this for for nearly 2 full years now. So why are we always saying, well, this study done in Israel and this study done in the UK, why aren't we doing real surveillance with these billions of dollars that we have in our health agencies?
Well, this is a very important point, and we surely agree that we need to do much better here. Make no mistake about that, we do. But let me just point out, for example, the money that we just talked about bought us these new vaccines. I give credit to both of the previous and the current administration for what we've done with vaccines. I would not want to be in China or Russia right now, where the vaccines that they have appear to not work against Omicron. Ours are working. So in a sense, that's an international success there. In terms of building the infrastructure, or in a very simple way of saying, how do we get case reports from the ground to some central location so that we can tell you what's going on? That's like trying to build a skyscraper. You can't do that overnight. And we are going to build this, and it's critical it gets done as soon as possible, but it's not going to happen overnight.
Yeah, well, I think a lot of people are frustrated by that. It sounds like you are too. It costs $15 billion to do Operation Warp Speed, and we've got at least 4 times that in the hopper in terms of money that's spent by these health agencies. Dr. Osterholm, you've been right about so much of this from the very beginning, so we really do appreciate you being here, Doctor,
Thank you.
and reading the articles that you have put forth. Thank you, sir. Good to see you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.